Hello friends, coronavirus subject is the main subject in the media right now. Just reading about the situation made me to be a little anxious about, therefore the subject of today's video will be coronavirus. In the first part of our discussion we'll talk about a statement from World Health Organization. Afterwards we'll discuss about some recommendations for international travelers. Now, without further ado, let's get into the subject. We were traveling a few days ago abroad, and I have to say that a constant question was popping out in my head regarding different articles about coronavirus around the world. Is it safe to travel in this period? Obviously, many of us maybe already bought holiday packages and we don't want to lose the money. So I have searched some information about it and I wanted to share them with you. Like many others, I was wondering why they don't just close the borders in the affected countries. In an official statement, World Health Organization is advising against the application of traveling or trade restriction to countries experiencing COVID-19 outbreak. Their evidence shows that restricting the movement of people and goods during public health emergencies is ineffective in most situations and may divert resources from other interventions. Restrictions may interrupt needed aid and technical support, may disrupt businesses, may have negative social and economic effects on the affected countries. However, in certain circumstances, measures that restrict movement of people may prove temporarily useful, such as in settings with few international connections and limited response capacities. Since World Health Organization declaration of public emergency of international concern in relation with COVID-19 and as of 27 February, 38 countries have reported to World Health Organization additional measures that significantly interfere with international traffic in relation with travel, from denial of entry of passengers, visa restrictions, or quarantine for travelers. Specific recommendations are already in place for those traveling to and from mainland China, for those who are traveling from other selected countries and areas including Cambodia, Hong Kong, Iran, Italy, Japan, Laos, Macau, Malaysia, Myanmar, Singapore, South Korea, Taiwan, Thailand, and Vietnam. Apparently, temperature screening alone is not an effective way to stop international spreading, since infected individuals may be in incubation period or may dissimulate fever through use of antipyretics. Now, regarding the international traveling, World Health Organization is advising international travelers to be prudent in their trips. Travelers who are sick should delay or avoid travel to affected areas, in particular the elderly and people with chronic disease or underlying health conditions. We should keep a distance at least 1 meter from persons showing symptoms. When it comes to personal hygiene, we should wash hands often with soap and running water for 20 seconds, particularly after contact with respiratory secretions. Use an alcohol-based sanitizer that contains at least 60% alcohol if soap and water are not available, especially after taking public transport. Cover your nose and mouth with a flex elbow or paper tissue when coughing or sneezing and dispose it immediately, and perform hand hygiene. We should avoid touching our eyes, nose and mouth with unwashed hands. If we wear a medical mask, it is critical to follow on how to wear, remove and dispose directions and perform hand hygiene after removal. For any travelers are also advised to follow proper food hygiene practices. Travelers returning from affected areas should self-monitor for symptoms such as fever, coughing, or difficulty breathing. They also advise to contact local health care provider and inform them of their symptoms and travel history. Some countries may require returning travelers to enter in quarantine. What to do if you become unwell abroad? Well, if you develop symptoms of cough or fever or shortness of breath, even if minor, while abroad during travel, you should immediately stay indoors and avoid contact with other people. If you become unwell at an airport, bus or train station before or during a long trip, seek medical attention and do not start or continue your journey. Call your health provider to discuss what should you do, and once you are fully recovered, check your health provider if you are fit to travel before any onward travel. Thank you for staying throughout the video with me. I was KOSONI Vlogs. Please subscribe to this channel, check my other videos. Don't forget to check my video about Curve app and use my link to create your Curve account. See you with my next video.